Okay, so welcome to part 2 of our skin integumentary system presentation. Alright, so now let's look at the types of primary skin disorder. Okay, so these would be things like pigmentary skin disorders, things that actually change the color or pigment of our skin, infectious processes that can happen to our skin, acne, rosacea, papillosquamous dermatosis, allergic disorders and drug reactions, and then arthropod infestation, so bugs essentially. Some primary skin disorders would be vitiligo, albinism, and melasma. So vitiligo is where there's a sudden appearance of white patches on the skin. It can happen anywhere on the skin. Michael Jackson actually had problems with vitiligo. You can see there whenever it was starting on his face. There's just a problem where the skin loses its pigmentation. So then it just becomes white in color, but there's still areas of regular pigmentation around it. And then as it progresses, more and more of the skin will just become whiter in pigment. Albinism, on the other hand, is people have it their entire life. It's not just a one-time occurrence like we see with vitiligo, where it starts and then progresses, and it's usually starting later in life, like adulthood. But with albinism, it's a genetic disorder, so they're going to have it from birth throughout their life, and it is where there's a complete or partial absence to the pigment of the skin. So that's where they have no pigmentation. So they're not going to have patches all over. They're going to have a loss of pigmentation. It can be in their skin, their hair, and even their eyes. So we can see in this child, they're very pale, and that's because their skin has no pigment. Their hair is very white, and that's because their hair doesn't have pigment. And then they've also lost pigment of their eyes. So like their irises do not have color to them, and they will often have white sclera and then red irises, and their corneas will look red as well. Melasma is disorder characterized by darkening of macules. So macules are very flat lesions on the skin. Right? It is benign, but you can see here it most often happens on the face. So you cross the cheeks and up onto the nose. Pregnant women are often prone, because of hormonal changes, to get melasma. They actually will call this sometimes the mask of pregnancy, and it will go away once their hormones stabilize. Another problem with the skin would be superficial fungal infection. So anytime you see tinea, all right, as part of a name of a problem, it relates to a fungus. All right, so you can have tinea of the body or face, the scalp, the foot, we often call this athlete's foot, or the hands, and the nails. So this is a common problem if you go to get manicures or pedicures from places that don't properly sanitize or clean their instruments that they use. You can get fungal infections of your nail beds. Dermatophytid reactions, so reactions that happen around the nail beds because of funguses, and then candida would be fungal infections. You can get candida, these are yeast infections. We often think of thrush, like the gentleman's mouth there at the bottom, but you can also get candida or yeast infections of the skin surfaces as well too, so not just in the mouth, but we often see those, and we showed pictures of these previously too in class, in the folds, in the skin fold areas, especially for patients who have larger skin folds or deeper skin folds. So obesity, women under their breast tissue, you'll find it in the armpits and the groin as well. So for instance, you would name these, especially if they're caused by a fungus, by the name, tinea for fungus, and then their location. So tinea corporis is ringworm, because corporis means circle, and this grows in a ring. Tinea pedis for foot, pedal, you think feet, that's for athlete's foot. And tinea unguinuum is the nail. Yeast infections would be Candida albicans. Alright, so this is a fungus that's caused by yeast type particles. Alright, and it's common after antibiotic therapy, because remember, antibiotics can also wipe out your normal flora. So once you wipe out your normal flora, things that shouldn't cause infection can, like yeast. So you can have this in your GI tract, you can have it in your mouth, and you can get it on their skin surfaces. But it's whenever, often we see it following antibiotic therapy. So here's some locations that people can get yeast infections. They're breast, groin, axilla, anus, umbilicus for kids, usually, most likely, especially newborns, toes, and in the finger web, so the spaces between the fingers and the toes. And think about that. Those are all dark areas that tend to be more warm and moist so that they make a nicer environment for yeast to grow. The vagina and the glands of the penis can also be prone to yeast infections. Again, they're usually moist and dark and warm. If it's in the mouth, we call it thrush, and then you can also get it in your nails as well. There's bacterial infections that can also cause problems with our integumentary system. Impetigo is a contagious skin infection that's caused by a bacteria. All right. It will often cause sores and a vesicle-type rash. You can see like tiny blisters on this one that can be prone to getting infected, especially if they break open. So this often spreads in daycare centers and among athletes in locker rooms or from using surfaces such as wrestlers can be very prone to impetigo, especially if the mats aren't cleaned properly between matches or practices, because they're often moving around and causing small abrasions on the skin, and then if the bacteria is on the surface of the mats, it's very easy for it to come in contact and to start causing infection. Staph, especially MRSA. Remember, MRSA is a very big problem because it's hard to treat and can cause a lot of problems in patients. It's methicillin-resistant Staph aureus, so it's a type of staph. But whenever we see Staph aureus, especially in the integumentary system, it is very sore for patients. It hurts. You can see the cellulitis or the red in the infection of the tissue surrounding it, and it will often also cause blisters as well. Viral infections can also cause skin problems, such as the human papillomavirus. It can also be an STD that can be spread as well. But you can see this, for instance, the human papillomavirus causes warts. That can happen. The STD version causes the genital warts, but you can also get it on the other areas of the skin. Herpes. Herpes, whenever we see a rash caused by herpes, no matter what type, whether it's chickenpox, genital herpes, we call those the dewdrop rash because it looks like a flower petal or rose petal underneath where it's nice and red and has that petal shape, and then it gets a blister on top where you see this little formation on top that's fluid filled, and that looks like the dewdrop. So if we see a dewdrop rose petal rash, we would want to think about herpes. Has the person been exposed to one of the forms of the herpes? Herpes zoster is shingles. Anybody who's ever had chickenpox or been exposed to the chickenpox virus in their lifetime is at risk of getting shingles later in life. Shingles tend to infect a nerve tract, so you will see the rash as it follows the nerve tract that it's infecting. So for instance, this person's, you can see it goes a straight line across their abdomen, their middle, their body. It's in a nerve tract that is innervating the abdominal cavity wall. So you will see that along the rash outbreak. And then it's still, notice the red rose petal dewdrop rash. This is very painful for patients, and these vesicles can also rupture and get risk for other infections or bacteria that can come in as well. There's also allergic and hypersensitivity reactions that can happen. Contact dermatitis often happens whenever you come in contact with something and it causes a skin rash. So this can be anything from being exposed to new laundry detergents that you don't like, or plants such as poison ivy and things. Eczema is also a type of dermatologic hypersensitivity reaction. where the skin is hypersensitive to something and it's causing eczema, which is a drying and flaking of the skin. Urticaria is hives. So oftentimes, especially people who are allergic to something, they can get hives from it. And this would be large, flat, sometimes fluid-filled skin eruptions that can happen because of an allergic reaction. And then you can also get drug-induced skin eruptions from medications, especially if people are allergic or hypersensitive to medications. For instance, a complication that people can get from having an allergic reaction to certain antibiotics would be Stevens-Johnson syndrome. This client in the bottom right has Stevens-Johnson syndrome, where it will cause mass skin eruptions to where it's almost like their integumentary system has like a chemical burn to it. And the skin will just slough off. Like you can see the area on the upper edge there of their abdomen, or on their back, and around their opposite shoulder blade and along the bottom where you can tell it's open and seeping or bleeding. This is where the skin is now sloughing off because of their allergic reaction. Here's a picture of a hive or an urticarial wheel. You can see how it's raised on the upper one but flat on the bottom one towards the wrist. Right, this is an example close-up of what that Stevens-Johnson's reaction looks like. You can see how it starts out with vesicles or the fluid-filled rash, and then eventually the skin starts to slough. And this can go and progress to any other areas of the integumentary system. So remember, like the lining of your mouth, your nose, your sinus passages, down your throat, it can be very painful, and there's a high risk for infection associated with this, as well as fluid and electrolyte imbalances, because they lose a normal amount of fluid and electrolytes through these areas of eruptions. Arthropods would be where we would have infestations because of some type of bug. Right? So for instance, scabies. Scabies are microarthropods that will burrow under the skin and cause infestations. They're very itchy. They're very irritating, and then they actually will crawl under the skin. So they will follow a path, and you can actually see them. Like if you look over the wrist area for this client, like right in here, you can see they're starting to burrow and move throughout the skin. People often will pick up scabies first, like on their legs. You can get them out in the walking around in the woods and things like that. They're also contagious, so they can be spread easily. For instance, through hospitals, if patients come in with scabies, especially if the linens and things aren't cleaned, and patients like sit in waiting rooms or things like that, they can be spread around. Lice, we probably have all heard of lice. It can be common in kids, especially if kids are sharing hairbrushes or have close contact with each other. You can get lice anywhere in your body that you have hair. We tend to usually see it in the scalp. You can also get body lice. You can get pubic lice as well, which we tend to refer to commonly as crabs. All right, ticks. Whenever we see ticks, we want to make sure that we're watching for signs of Rocky Mountain spotted fever and especially Lyme disease in this area. So we would watch for the rash. And then signs and symptoms of these, even months out, because it can take a while to incubate in patients. For instance, here's the bullseye rash that we saw earlier in the last presentation that can happen with Lyme disease. Patients with Lyme disease, only about half of them actually get that rash. So it's important to remember that if they're having the signs and symptoms, especially if they've ever seen a tick on themselves, they can have the Lyme disease, even if they haven't had the rash. People tend to think, oh, I didn't get the rash, I don't have it, I don't have to worry about it, but that's not the case. And the ticks that carry Lyme disease are actually the very tiny black deer tick, not these big green ones that we tend to pull off for pets. They can carry other things like Rocky Mountain spotted fever, but it's these teeny tiny little black deer ticks that we should be concerned about with Lyme disease. Okay, so we'll stop here. We'll pick up the rest in our last part, part 3, and I will talk to you then about the remainder of the integumentary system.